missing a couple, eh?
Oh, Ron's in the coffee room.
Oh, is he? Okay, all right.
I told you he's talking.
He's not long-winded, is he? First order of business is to approve, Tuesday's committee meeting minutes. Motion made by Supervisor Frazier, seconded by Supervisor McDevitt. All in favor?
Aye.
Opposed? Carried. Okay, first on slate is public health. Pat, take it away.
Okay, first thing, we have a late-breaking, item, the first page of your agenda that, would be to request committee approval, to allow Tony Roth, our WIC, program coordinator, to attend the 2015 New York State Managers Workshop in Suffern, New York. She's looking forward to going there like look forward to, Altoona, but usually it's held in Albany for the past few years, but this year it's in Suffern, so she needs to go there, and it is covered in full, but it's overnight, 2 nights, so we need to get committee approval for that.
Okay, motion made by Supervisor Frazier, seconded by Supervisor McDevitt. All in favor?
Aye.
Opposed? Carried. Okay.
We'd also like to request a resolution to authorize participation agreement with the Healthcare Information Exchange of New York, which is called HIXNY, to allow accessing aggregated patient clinical data, which is held by multiple healthcare organizations, and Tammy can comment more on that, for an amount of $500. It's a one-time installation fee, and it's just going to allow us to be part of a larger group, and it's where the technology goes.
It's part of, actually, we're involved in the district program through AHI, and one of the, if you look through the deliverables, this is actually a piece in that deliverables. And what it is all the agencies that are part of it put their data up into this regional health information. And everybody puts their information in. Glens Falls Hospital's a member, Hudson Headwaters is a member, Iron Gate, all of our big physician practices, CVPH, hospital, and we're able to then get data. If we have a patient that's assigned to us, we can go up into HIXNY and we can gather relevant data for that patient. That'll help us when we go out to assess the patient. It'll help us to get some of the historic information, medication. Hopefully it'll help us with our medication reconciliations. It'll get us some discharge summaries, some diagnosis codes, and things like that. So the reason that it can be so cost effective is New York State has a HEAL grant, and they funneled a ton of money into programs like this so that they can build the infrastructure so that different providers can collaborate on patient care. So anyway, that's what that is.
Good. Thank
And
you.
there was a grant that was funded as a one-time startup fee, so that's why it's only going to cost us $500, and the grant's only going to be for a certain amount of time. Because with the HIXNY, Tammy and I had looked at that a number of years ago, but it was really cost-effective for us at that time. Everything moving forward with health information, for any of you that go to Hudson Headwaters, for example, you go in and sign that little thing so that your information can be shared globally. That's what this is for. So if I go to see you and you've had a hospitalization and you, for some reason, forgot to tell us or whatever, I would have access to that information to help coordinate the care we provide.
Okay. Need a motion, please? Made by Supervisor McDevitt, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
Moving on, we'd like to request a resolution to authorize a business associate agreement with Melissa Lemery, who is a registered dietitian, to provide nutrition services for patients. Registered dietitians are difficult to come by, and we actually came up with this girl when she was an intern in our WIC program. So she's anxious to make a contract with us, and
Good.
they're billable visits.
Okay. Motion made by Supervisor McDevitt, seconded by, don't even put your hand up.
Just a bit.
Supervisor McDevitt, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
We would also like to request committee approval to allow Sharon to attend the Home Care Association Quality Symposium in Troy on November 17th at a cost of $279, and that's going to provide a lot of quality improvement topics, which we certainly need to stay abreast of.
Okay, motion made by Supervisor McDevitt, seconded by Supervisor Frazier. Discussion? All in favor?
Aye.
Opposed? Carried. Okay.
We need resolution for budget transfers and, budget amendments, and Ton, if you would like to comment on that?
Attachment number 5 are all our transfers, and, I don't think I need to go each one, but if you want me to, but basically what it is I kind of analyzed some salary and some fringe to the end of the year, and this is where I feel I need to move a little bit of money to make sure it's covered. I'll analyze it again for the next meeting in case I need to move more or adjust anything, but this is where right now I feel comfortable that it will get us to where we need to for the end of the year. Retirement expense, it does change through the year, the percentage, so I think budget-wise, it tends to be under budgeted, so I have to definitely move some there. A little bit in salaries, and, one of our other one is, of course, with our child, that we're utilizing more per diem for our nurses, because we have some vacancies, so I need to just keep moving a little bit of money from full-time into that part-time salary to keep that coverage. So those total $19,300 between moving within all our departments, basically, like I said, to cover salary and fringe benefits to the end of the year.
Okay, motion made by Supervisor Frazier, seconded by Supervisor McDevitt. All in favor?
Aye.
Opposed?
Attachment number 6, which is the next form, is basically, we got our $13,000 performance incentive award, and I just need to amend the budget. The disease program is what it's for, to show the, expense and revenue for that. This will be utilized by the end of this year, so we're asking for it in 2015.
Okay. Motion made by Supervisor McDevitt, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
We don't have any pending items this month, so moving on for information for, discussion and review, you'll see attachment number 1 is our monthly emergency response plan. If anybody has any questions on that, otherwise I guess it's pretty straightforward. And moving on to status of referrals, you'll see your detailed report. Sharon, do you have any comment on that?
No, we're still holding our own and, are equal to what we've been last year, actually. We're up 1%.
Tom, you're back on again here with your reports of expenditures.
Attachment number 2 are financials as of October 19th. You'll see again with salaries, we're holding our own, we're 73.69% of salaries of the budget for now. Last year at this time, we were 75.98%, so we're doing well there. Overall, you'll see the variance in the bottom with salaries. Our regular salaries are down because of our positions that are open. Overtime is down a little bit, which is nice, but that's also because we've got the part-timers, which you'll see that is up. Financial-wise, I did have to accrue some things. We had a little bit of a problem with our August billings. We had to get some things fixed, so we had just closed that. We're working on closing September. So that does not reflect, but I have accrued some things that hadn't been posted yet. Some of our quarterly reports, our WIC grant, our Children's Special Health Needs grant, our Early Intervention grant, and the last big thing is our preschool, which is $404,755, which was our report that we sent into the state to get reimbursed, and that was for the third one for the 14-15 school year, and we just did that, so I wanted to accrue that into our revenues too. We'll be getting that from the state. Attachment number 3, which is our comparison between last year and this year. I have to find it. There. Basically, again, you'll see the salaries, which are reflected in the page before, so that, the contractual, we seem to be up a little bit, but when I went back and did comparison from last year to this year, it seems to be primarily in one vendor that last year we had not paid the summer at this time when we had our meeting. We had not paid any of the summer expenses. We're not billed into the system, where this year we're right on top of it and they're in there. So that's the primary reason. Otherwise, they're pretty much going to be about break even. And regarding our revenues, again, you'll see compared to where we are right now, about $358,000 off, and that is pretty much our September revenues, which we're expecting to get. Last year at this time, we had booked the September, but because of our delay, we haven't booked it yet. So again, we're pretty much on target right now with budget as of today.
Very good. Any questions from the committee?
Just flu shots for employees, is that gonna happen, or has it happened already?
We have a schedule for it, yeah, we have clinics like 3 times a week. Pretty much whenever you wanna come, we'll accommodate you.
Okay, thank you.
clinics actually in the community have been kind of slow this year, but we expected that because it's so readily available. And
Yeah.
as long as people have opportunity to get them, that's all we care.
And you go to a drugstore today, they're always,
Yeah.
they're all asking.
Anything else for public health?
That's all we have.
Okay, thank you, ladies.
Thank you, Nick.
Thank you.
Appreciate it, guys.
Good
Have a
job.
good weekend.
Thanks, you too.
Conover still talking, or is it?
Yeah, I'm sure it is.
Let 'em stay.
I think we'll move right along.
Faster meetings, huh?
Did you know this? Oh, dear. I laugh, I always say, gee, I wonder how long his town board meetings are. Oh, dear.
I'm a little hungry. All right, Rob, you got your big heavy agenda ready?
I do. Okay. Just one quick item, and this is the request to transfer funds. Has been amended since the packet was sent out. Originally, we thought we were gonna need to request 40,000 to move over, but it looks like we only need 25. So we have the amended request here. This is 100% county dollars, and this is related to a chargeback that we received from New York State. It's a mandated expense when we have individuals in the jail who are determined to be not competent to stand trial. Then they get remanded to New York State facility, and there's a chargeback to the county for 50% of the per diem rate, hospitalization rate. The hospitalization rate currently is a little over $1,000 a day. It's $1,080 a day, and so 50% of that gets charged back to the county, $540.37 per day. So we had an individual who was in there. These are somewhat unpredictable. I mean, we just don't know when we're going to have them or how many we're going to have in any given year. I did put a table together that just shows what the expenses have looked like in this line over the last several years. First table that you have is where we were through August, and looking at the bottom portion for the criminal evals, 2015 we had budgeted 25,000. We at the end of August we were at 21,000 for year-to-date expenses. Then below that you see September we received an additional invoice for $16,752, so that will give us a budget overrun. So in order to cover the budget overrun of $12,763, as well as to leave some additional funding for the actual examinations for 730s and other mental health court-ordered evaluations, we felt that 25,000 was the appropriate number.
Okay, need a motion to probably move this on to finance. Motion made by Supervisor McDevitt, seconded by Supervisor Frazier. Any discussion? All in favor? Opposed? Carried. Thank you, Rob.
Thank you. Right.
We're just breezing through this.
We are.
I guess.
Conover, you come late more often.
I told him, Ron, you were just in there talking anyway, so.
Gonna go faster, huh? I thought it was 10.
I had it down as 10. Apologies.
You sir? We are ready when you are, Lloyd.
Yeah, Mr. Chairman. We have a pretty short agenda here as far as today goes. I thank Amanda and her people. We thought Mike McCarthy was going to be able to come today, and he has a medical procedure this morning, so we had to move things around a little bit and delete him obviously from the agenda. So hopefully we'll get him in here before the end of the year. Only have 2 items, today. We're kinda getting time sensitive here on the sale and everything, and, I think we're probably on target for end of the year sale. We have certain contracts that come up, for renewal, and that's what we're gonna have to deal with today. We have about 8 contracts that come up at the end of the year, so I'm not sure how this plays out exactly. Hopefully we'll go right to the day maybe, I'm not sure, but, we're working with, centers already, to, get contracts to them on who we currently have, all kinds of information. They're coming up to the facility next week, several different departments to get things started. Basically, it's an information gathering. It's to see where we are now and where they're gonna move forward, going forward, so. The first one is a contract for renewal of our social work consulting services. This is a gentleman who basically comes, 4 times a year. I think it's a total of like $2,100. So I'm looking to renew that, you know, for another year, but we'll see how it goes as far as how long it actually is in place.
Right.
So that's for our social work consultant.
Motion made by Supervisor Frazier, seconded by Supervisor McDevitt. Any discussion? All in favor? Opposed? Carried. 2.
Next one, we wanna renew Hudson Headwaters contract. They do several different things for us. One, is obviously the medical director component, and we pay, about $1,200 a month for that one. And we pay for employee physicals through them. Betsy noted that the, Countryside contract was renewed with Hudson Headwaters, and their physical exam charge went to $100. They requested that for ours also, so we were at 95, we'll be going to 100. But once again, all these things, this contract would take effect the first of the year, so like I said, maybe you approve something that may not even be in place, but we don't know that, so. I think we wanna be ready with at least this one. This is a very important contract, obviously. And I'd just like to have permission to move forward for a new contract, starting the first of the year at that new rate.
Motion made by Supervisor Conover, seconded by Supervisor McDevitt. All in favor?
Aye.
Opposed? Carried.
Those were the 2 action items. Unless the committee has any specific questions of me, how things are going or anything, I can give a quick update if you want anything, or...
Just, we talked a little earlier, but just to follow up from our discussion when centers went there after the meeting Tuesday.
After the meeting Tuesday, they came over, met with department heads primarily. We met for probably an hour or so. Department heads had some questions about, how things are gonna play out, this and that. And, they met with me individually and, basically offered me a job, so I took it. So I will be staying on. So, limit that discussion. So I'll be staying on with them. Basically, we've changed a lot of information back and forth, who's who handles what for them, and they've already been in touch with us, at least 6 or 7 different people through emails. We've submitted a lot of documents. Jackie and HR has been very helpful, moving forward, getting information, payroll records, this and that. The contracts are being sent down that we currently have in place and, what they can roll over. That type of stuff. Managed care contracts that we have in place will have to be rolled over to them. So it's a lot of detail, but they're actively moving forward on it, and hopefully we'll have everything in place. And we're anticipating, unless someone tells me differently, an end of the year closing on this. So that's what we're up to.
Comforting to know that you will be there.
I was just gonna say that, and they know they've got a good man, so I guess they didn't.
Absolutely.
Maybe we get that one off the table quick.
Keep those stars up there.
Yeah, guarantee those stars.
Okay, anything else for Lloyd? Supervisor Brock?
How's morale?
I think it's more apprehension than anything else. I think once everybody heard I was gonna stay on, that kinda took away a little bit of indecision. And I've said before, a lot of our people there are new. So they don't have the issues of the county of I've been there 26 years and this and that. Those people have already moved on, such as like Betsy, the controller, and other people. So, we've weathered that storm a little bit already. You still have a lot of, long-term people there in nursing, especially. When they made the statement that no clinical jobs will be cut, I think that was very reassuring. I mean, that's basically what they said, they reiterated it in the other meetings. So, there would be nothing to cut. I mean, if you wait an hour, someone's gonna leave anyway, so it doesn't really make a lot of difference about, getting rid of any jobs, but we're looking at all those areas, and, I think the biggest thing will be when they realize, you know, the benefit package obviously has to be curtailed, and some of the holidays and that type of stuff. They've been upfront with that for the 2.5 years I've been there, so it's not gonna come as, a shock, but when it really hits, I think then it'll be, you know, it'll hit home then.
Good. Thank you for the update. Okay, if nothing else, motion to adjourn, made by Supervisor Frazier, second by Supervisor McDevitt. All in favor? Opposed?
Okay.
Thank you.
Thank you, Lloyd.
Yep.